Well, for as long as I can remember, I wanted to be a physician. I had an injury in my foot when I was a child and spent a lot of time, a lot of weeks and months in a hospital and in orthopedic surgery clinics, and I knew from a very, very early age that I wanted to be a physician. So it was a pretty easy decision for me. I've always enjoyed the diseases that occur in the abdomen, and I like doing procedures as well. So this was a natural fit for me. I did my training at Emory in Atlanta, and my wife and I wanted to stay in the South, and I wanted to join a big group, which was important to me, and it's been a good fit for us. I think there are a lot of benefits from being in a large group, and I think that the main benefit is that it allows individual doctors to carve out specialty areas and niches that they can become very proficient at. And because of our size, we have a lot of patients in our practice, and those patients who have uncommon and unusual diseases, we can funnel to those physicians in our practice who have a specialty in those diseases. And as a result, they get to see a lot of uncommon diseases on a regular basis, and I think that makes for a better clinical outcome for the patient. My philosophy on screening for cancer, I think it's well worth doing. I've had my colonoscopy when I turned 50, and my wife will have hers. Actually, she's had hers. There's a family history there. And I try to follow the national guidelines. I think there are exceptions that can be made for certain people who have a very strong family history. But in general, myself and the other physician in our group try to follow the national guidelines and national recommendations from our societies who study the matters. And I think screening colonoscopy is a very worthwhile endeavor. Follow-up is very important because once the diagnosis and treatment have been established, to make sure that the patient is getting the result that the physician wants and the patient wants. And also there are secondary issues that come up months and years later with many diseases that need follow-up and are going to be missed if the patient doesn't come back to the office. The main thing that you have to do as a physician for those patients who may have a hard time putting into words that describe their condition is just be patient with them and listen, and eventually they can get out the information that you need to know as a physician. But you just have to be patient and keep listening. My ultimate goal in treating a patient is making a correct diagnosis, because they had a problem and otherwise they wouldn't be in our office, and we want to make the diagnosis and solve the problem that they came to see us for and get them back to either work or play or whatever the case may be.